So hello friends, I hope I'm audible and visible. Can I get a quick thumbs up from all my dear students? Let me just check if my audio video is all fine. Just give me a second, all of you. Yes. So welcome on this best online platform, that is Unacademy, for your NEET PG preparation. I'm Dr. Chesta Aggarwal. Now let me very quickly check if my class is live and you all can see me. Just give me a second. Yes. So welcome all of you. Today we have an offer which is only for 3 days. I request all my students to kindly go ahead and get your subscription today. Now what we are providing you a 6-month subscription free when you get a 1-year subscription, and same thing is with the 6-month subscription, you'll get a 3-month for free. I request all my students to kindly get yourself enrolled and use my code CHESTA10 to get your Unacademy subscription today. Now this offer is only for 3 days, that is on 13th, 14th and 15th. So I request all of you to please unbox this popular scheme. You will get around 20% discount if you use my code, that is CHESTA10. We have also started with a new batch of Target NEET PG where we have a module 1 which includes the 6-month batch where the subject wise teaching will be done, and then for the next 3 months we will have a high yield revision batch of NEET PG with all the 19 subjects. We are also starting with the TND batch for the repeaters of NEET PG 2023. It will start on 8th June and will end on 30th September. The module 2 covers the high yield batch which starts from October to December. Now this is the price list. I request everyone to kindly use my code, that is CHESTA10. Requesting all of you to kindly use my code CHESTA10. Now let's start with the question and answer discussion of the today's class. Very important session. Arrange the following structure in the skin in order of top to bottom from the most superficial to deep. Now this is a quick revision. I am starting this comprehensive batch course in such a way that the topic wise or the chapter wise discussion of the dermatology will be done here. Requesting all of you to kindly answer this. Very well done all of you, very nice. Now arrange the following structures in the skin in order of top to bottom from the most superficial to the deepest. Now we have few options, that is desmoglein, hemidesmosome, collagen 7 and laminin. Please remember, desmoglein is the part of intercellular spaces of epidermis. So desmoglein belongs to epidermis. Hemidesmosome is present at the lower part of the stratum basale cells, just between the epidermis and dermis. So you can just mention it here as at the level of stratum basale. Collagen 7 is at the level of dermis and laminin is at the level of basement membrane. So if you have to draw the structure of your skin, it is somewhat like this. This is your epidermis, this is your basement membrane, this is your dermis. So first come the epidermis, then the lower layer of the epidermis, that is the hemidesmosome, so 1 followed by 2. Then we have basement membrane, that is 4, and then collagen 7, that is option number 3. The correct answer of this question becomes option number 4. Is that clear? Is that clear to all of you? Swati, I hope there is no confusion. This is the first slide. Please remember that in your skin you have a lot of structures which are actually the adhesion molecule which help in connecting between the two adjacent structures. The very important adhesive molecule which we have in the epidermis is known as desmosome, and one of the component of desmosome is desmoglein. There is one more molecule which is only present at the lower surface of the stratum basale, known as hemidesmosome. Then we have basement membrane, which is made up of two components, lamina lucida and lamina densa. Lamina lucida consists of laminin. Just beneath the basement membrane we have collagen 7. So the correct sequence becomes option number 4. Now the next question is, you have to pick the parts of desmosome. Tell me what are the different parts of the desmosome. Tell me what are the different parts of the desmosome. Please tell me the correct answer, everyone. Pick the part of desmosomes. Anyone, what is the correct answer of this question? Pick the parts of desmosome. Now, very well done, all of you. What is desmosome? I have just now told you that desmosome is nothing but the intercellular adhesive molecule. So, if this is one keratinocyte and this is another keratinocyte, desmosome is present in between them. So, we have different components of desmosome. Two components are present outside the cell or in between the cells, and these are known as intercellular component. These are the two intercellular components which are present in between the cells. The green one here is desmoglein and the red one here is desmocholine. So we have a desmoglein and desmocholine. Then we have few intracellular components also. The name of these intracellular components are desmoplakin, placoglobin, placofilin. So the intracellular component, they are nothing but the plakin group of family, but the intercellular component are desmoglein and desmocholine. So which is not the part? Please remember laminin, which we have discussed, it is the part of the basement membrane zone. The correct answer of this is option number 1. Now for understanding this topic more in detail, let us discuss something called as the basement membrane zone structures. Let us discuss the basement membrane zone. Let us discuss the basement membrane zone, which is a very important part or very important thing. Now, just imagine that these are the 2 or 3 cells of the stratum basale. What are these cells? These are nothing but the stratum basale cell. What do you have beneath the stratum basale? This is basement membrane, and beneath the basement membrane you have dermis. This is stratum basale. Now what is the component which is present in between the 2 cells of stratum basale? Can you tell me what glue is this? Which is this red color structure which is connecting the 2 adjacent stratum basale? Anyone can tell me? This is desmosome. There is one more glue which is present on the under surface of the stratum basale. Present on the under surface of the stratum basale. This is known as hemidesmosome. Now basement membrane, it is divided into 2 parts. Basement membrane has divided into 2 parts. The superficial part is known as lamina lucida. Lamina lucida. And the denser or the lower part is known as lamina densa. Please remember, lamina lucida is made up of laminin 5, BP antigen 2, which is BP 180, and alpha 6 beta 4 integrin. What are these? These are laminin 5, BP antigen 2, and alpha 6 beta 4 integrin. While lamina densa, it is made up of collagen 4. Just beneath the lamina densa, the part of the dermis which is present, it contains the collagen fibers, collagen 7, and this part is known as sublamina densa. This part is known as sublamina densa. Please give me a quick thumbs up if you are clear with the basement membrane zone and its structure. It is very important. Okay, so if you get a question something like this, and even if you have to arrange them, if you remember the first question, you have to arrange them in the sequence. The most superficial is the desmosome, then hemidesmosome, then laminin, and then the collagen 7. So that becomes the sequence. Clear? Now please tell me the correct answer of this question. Check the histopathological terms and their association. What is the correct answer here? Can anybody tell me? Very nice. Now check the histopathological terms and their association. Please remember, colloid body erythema multiforme. Colloid body erythema multiforme. This is the correct sequence. Now in erythema multiforme you have basal cell degeneration. And whenever you have basal cell degeneration, you see colloid bodies, cavite bodies and cytoid bodies. A very simple example is in lichen planus also you have basal cell degeneration, and that is why the colloid bodies are seen. The colloid bodies are seen. Clear? Anything else? Anything confusion? No. Now what is epidermotrophism? What is epidermotrophism? Epidermotrophism is nothing but collection of T lymphocytes in the epidermis, or affinity of T lymphocyte to the epidermis is a very classical term, that is epidermotrophism, and it is seen in the patients of mycosis fungoides. Manish, in today's lecture the course includes the basics, so we are discussing the questions from the basics of skin, the basics of histopathology. So few terms you need to know, like what is epidermotrophism, what is spongiosis, colloid body. So today we are trying to discuss a lot of basics. We are not going much in detail because definitely we have a plus course which will be following these sessions where you can understand the subject more in detail, but I'll try to touch almost everything whatever is important for you. So option number 2 becomes wrong. Option number 2 is not correct. Let me just check it. Yes. Option number 3 is spongiosis. What do you mean by spongiosis? It means that there is intercellular edema, and yes, it's a characteristic feature of eczema. Parakeratosis means you have retention of the nucleus. You have retention of the nucleus in the cells of the epidermis, and it is a very classical feature of psoriasis. So only option number A and C is correct. So for me the correct answer becomes option number 2. Clear? So number A and C is the correct option for the histopathological terms. Moving to the next question, match the findings of column A with that of column number B. We are mainly discussing the basic questions, so please try to answer. Please tell me the correct answer, all my dear students. Match the finding of column A with the best alternative, column number B. Anyone? Raj, Swati, Dr. Benedict, Manish, what is the correct answer? Now these terminologies like papules, pustules, macules, vesicles, bullae, they become very important for you. Okay, they become very, very important because you get questions like this. You can get a direct question which includes the image and they can ask you the answer. So please, you have to know this. Starting with first, papule. Please remember, it is a solid raised structure of less than 1 centimeter. So 1 goes for B. 1 goes for B. What is a plaque? It is a elevated lesion. It can be depressed also, but most of the cases it is elevated and the size is more than 1 centimeter. So 2 goes for F, 1 goes for B and 2 goes for F. Coming to the option number 3, which is a wheal, option number 3. Wheal is nothing but a transient. It is an edema which occurs or which remains on the body only for less than 24 hours. So it is a transient elevated edematous lesion of the body. What is a macule? It is a flat lesion of less than 1 centimeter in size. So the correct answer of this question becomes option number 1. Fluid filled lesion of less than 1 centimeter is nothing but a vesicle. And solid, this is done. Masses of more than 2 centimeter is a nodule. So try to remember the definition of each and everything because you can get a question here. Now the another question is on your screen. A 5-year-old boy goes to the physician for evaluation of a mole. It first appeared about 6 months ago. On physical examination, the spot appears as a dark brown symmetrical macule on the abdomen. The cell type responsible for this pigmentary lesion is seen in which of the following layer? What is the correct answer here? Anyone? Very nice. A 5-year-old boy goes to the physician for evaluation of a mole. Now please remember, in our body there is only one cell, or in our skin there is only one cell which produces the pigment. And what is that cell? That cell is melanocyte. Now these melanocytes, they are located in the stratum basale. So let us make an image, a very interesting image of all the different layers. That becomes very easy for you to understand then. This is the stratum corneum, the outermost layer of the epidermis, stratum corneum. Beneath stratum corneum, all over the body other than palm and sole, which layer is seen? Just beneath the stratum corneum, can you tell me, other than palm and sole, which layer do you see? You see granular cell layer. So there are a lot of granules. This is known as a granular cell layer, stratum granulosum. Beneath this we have a polygonal cell layer where you have a large polygonal cells, thickest layer of the skin. It is the thickest layer. Stratum spinosum. And we have a lower layer which is stratum basale. So these are the layer. Beneath the stratum basale we have discussed that we have basement membrane. Now we have different layers here. We have different layer here, or different cells which are present. There are few cells which are present in the stratum basale which have dendrites, which goes like this in between the cells of the stratum spinosum. So which is this cell? What is this dendritic cell which is seen in the stratum basale layer? This dendritic cell which you see in the stratum basale, this is a melanocyte. It produces the pigment, and after the pigment get produced, it is distributed to surrounding keratinocyte in such a way that one melanocyte supply the color to 36 keratinocytes. So one melanocyte is supplying the color to 36 keratinocyte. Now we have another cell. Look at this. This yellow color cell is nothing but a Merkel cell, which is a touch receptor. Merkel cell, which is a touch receptor connected to the underlying nerve. And other than this, we have one more cell which is present in the stratum spinosum layer, which is also a dendritic cell. Can you see? You have long dendrites like this. This is a Langerhans cell, which is a antigen presenting cell and the first defense mechanism. So thank you Manish. If you like the classes, I would also request all my students to kindly use my code CHESTA10 CHESTA10 to get amazing discounts on the Unacademy app. As on Unacademy app, we are providing you the 6-month subscription for free if anybody is targeting for NEET PG 2023. And for this you might need a code. Please use my code. The name is CHESTA10. CHESTA10 is my code. Okay. So we are done with this question, and please remember the layer number E is actually the stratum basale. So the pigment producing cells are present in the last layer, that is the stratum basale. I hope this question is clear to all of you. Now moving to the next question. I think I need to shift it a little bit. Yes, now tell me the answer. A 30-year-old female presented with a new onset skin lesion on her back. On examination, there is a flat skin lesion of less than 1 centimeter that differs in the color from the surrounding skin. Which of the following is the most likely lesion that can be seen in this patient? Okay, very nice everyone. If you have subscribed, that is well and good. What will be the correct answer of this question? Okay, the question says that we have a 30-year-old female who presented with the new onset skin lesions on her back. So the lesions are new onset in a 30-year-old female. They are flat, neither raised and neither depressed. So anybody can recall and tell me what is that? Please remember, if it is flat, it has to be either a macule or a patch, but they clearly mention that the size is less than 1 centimeter. And please all my dear students, remember, if it is less than 1 centimeter, it has to be a patient of macule. So the correct answer is A. Swati, Kiran, Medquest, Sam, Just Me, Raj, Dr. Benedict. Everybody, you are right. This is a very easy question of the simple identification of the lesions. Now this is another question. Let me see if you can answer this. And I think after this, how to enroll for the 6-month free course? Anyone? Manish, if you want to enroll for a 6-month free course, you have to take a 1-year course first. And if you take a 1-year course, the 6-month course will be given to you extra. So you will get 1.5 year subscription in just rupees or just paying for 1 year. Okay. So you can use my code, that is CHESTA10. For getting enrolled, just go to your Unacademy learning app, use this code. For 12 months, you will get 6 months free. And on buying a 6-month subscription, you will get 3 months free. So I would highly recommend all of you to go for a 6-month subscription where you can get 3 months free. So in total, you will get a subscription of 9 months in just amount of 6 months. Clear? Very nice. The question is, a 55-year-old man with cirrhosis comes to the physician because of weakness, increasing abdominal girth and confusion. Physical examination shows ascites, redness on his palm but not on the dorsum. The redness is found to be due to dilated capillaries because of high estrogen. Which of the following structure are most likely would be supplied by these dilated capillaries on the palm but not on the dorsum? So it's actually a very easy question but little twisted. They want you to tell, or they are asking you that which is that extra layer which is present in palm and sole which is missing on the dorsal aspect. Please remember the correct answer is stratum lucidum layer. You do not get stratum lucidum on your dorsal aspect or anywhere other than your palm and sole, and that is why the correct answer becomes the clear. Anyone with any confusion? Can I get a quick thumbs up from all of you? I hope there is no confusion. Nice, very nice. Now let's move to the this question. We are done. Next question. It's a little difficult question because now we are moving to the appendageal disorders and related question. So I think this would be the last question. We are already done with 25 minutes, so we'll take 5 more minutes and then we will wind up. Okay? So please tell me the answer. A 30-year-old female who presented with inframammary rump. They are tender and have a foul smelling odor. She has had previous episodes of painful swelling in the axilla that resolved with antibiotic therapy, leaving some scarring. She has Crohn's disease, and on examination we have a right inframammary fold which shows multiple tender erythematous nodule, fistulae with purulent discharge. Which of the following areas are most likely to be affected by this patient's condition? Yashika, the 6 plus 3 month extra subscription, the offer is only till 15th. So that is today is 13th, right? So till 15th of June. Till 15th of June, if you use my code CHESTA10, you can avail this 6 plus 3 offer. Okay. The correct answer of this question is groin. And can anybody tell me what can be the diagnosis? You are right, Kiran, Benedict, Sam, you all are right. The answer is option number 3, because it's a very classical description of a disease which is known as hidradenitis suppurativa. Okay, hidradenitis suppurativa. Yes, so if today is 14th, I'm very sorry, today is 14th. Then please remember the offer is only till tomorrow. So tomorrow, I think till midnight you can avail this offer. So just try to use it, because it's a very important and actually a very good subscription. In a way, you are getting more than 10% discount on your offer. So try to take it. So with this, we are done with the session. Now, what is hidradenitis suppurativa? I request all of you to please download the Unacademy Learning app and watch my comprehensive course over there. I've already taken a comprehensive course and one more course will be live soon. So requesting all of you to please download the app and use my code to get yourself enrolled on Unacademy, and we will be discussing hidradenitis suppurativa there more in detail. So till then, good day all of you, good night all of you. We'll meet almost every day either on the special class or on the YouTube. Tomorrow we have a class, a special class at 3 p.m. So I would be requesting my students to please download. You may need a code on Unacademy for buying or for getting yourself free classes, free test. This is my code. Please use it.